Good evening. Thanks for joining us. We begin tonight with more confirmed cases of the new variant of COVID-19 in Canada. This afternoon, health authorities in Ottawa announced a case there and now a confirmed case in BC. All of the cases are now linked to travel, but health experts believe community spread of this new highly contagious variant is inevitable. Abigail Bimman has our top story tonight.
This is now just the tip of the iceberg.
It's pretty much entrenched. It's going to be with us.
While there are only a few confirmed cases of the UK variant in Canada, experts believe there are likely more. Genome sequencing to find it doesn't happen automatically with every COVID-19 test. Ontario is now ramping up sequencing dramatically.
We tested less than 10% of the positive cases to date, but we expect to be at much higher numbers very shortly.
The new cases in Ottawa and Vancouver Island involved individuals who returned from the UK. And Ontario now says the two cases east of Toronto did have contact with a UK traveler, contrary to what they said Saturday.
And there certainly are a lot of unanswered questions.
There is no evidence the new strain is more deadly nor causes a worse illness.
The general consensus is that it's probably a bit more transmissible. It's just not quite clear how much more.
This is a perfect curveball for our attempts to control the pandemic.
The scientific director of Ontario's COVID-19 Advisory Science Table says a virus that's even a little more contagious could pose a big problem. Peter Uni wants everyone to follow the rules. A new province-wide lockdown kicked in Saturday.
Even 10% means that we need to do even more restrictions to keep this sort of under control. And we know already how much we struggle right now. We need to take that very seriously.
Something experts are tracking carefully. You may have heard of the spike protein.
This virus is like a little ball, but it has these molecules of protein which are like little spikes that stick up on the surface. They make it easier for the virus to attach to the cell.
It needs the spike protein to get into our cells and cause an infection in us. It's also the part of the virus that the vaccine is designed to target.
It has a lot of mutations in the spike protein, 7 changes, but the spike protein's pretty long, and so there's still a lot to recognize.
The consensus is the new variant won't have an impact on the vaccine's effectiveness, but more research is underway, and so is more sequencing to figure out how many cases exist in Canada and how long they've been here. Colleen?
Abigail Bimman in Ottawa. Thanks, Abigail.